Discovering what your unique posture and movement tendencies are is the first step in understanding the mechanical stresses that affect your back pain. Use the following analysis to help you target what body mechanical corrections are needed to stimulate your back healing. Check the posture of the feet while standing first. Enlist the help of a friend to view you from behind. Normally, each heel should have equal body weight placed on the inner and outer edge. Pronation is when more weight is placed on the inner edge, and supination when more weight is placed on the outer edge. Check this during walking as well. During mid-stance, when the foot is flat and the hip is directly above it, pronation and supination can be identified as well. Next, check your posture for alignment in the standing position. Normally, the shoulders, eyes, ears, hips, and lower rib cage should all be level. Check to see if you have a tendency to lean to one side with any of these body regions or elevate one hip higher than another. Check also for rotation. Normally, the front of the pelvis and chest should be flat across. See if you have a tendency to have your chest rotate more to one side or your hips to rotate slightly to one side. Check also for hip rotation. External rotation of the hip is identified when the knee and the toe both turn outwards from the midline. Check to see if that's equal on both sides or if one side is greater than another, as well as if you stand normally with one foot slightly forward. That's often on the side that the leg is more externally rotated. Check also for lateral translation postures. Normally, the box of the head, the box of the ribs, and the box of the pelvis should all be stacked on top of each other. Some people have a tendency to stand with one box or body region positioned sideways or shifted sideways compared to another. Check to see if you have a lateral translation of your pelvis, a lateral translation of your rib cage, or a lateral translation of your head. Next, check your posture from the side. You can use a mirror or the help of a friend. Normally, a vertical line should exist between the ear, shoulder, hip, and knee. Sway back posture is when the hips are positioned more forward than the knee and the shoulder. Forward head posture exists when the ear is more forward than the shoulder. And normally a horizontal level line should exist between the bottom of the nose and the back of the skull. Extended head posture is when the bottom of the nose is higher than the back of the skull. This is often associated with a forward head posture. Normally, the contour of the front of the shoulder should be flat. Rounded shoulder posture exists when that contour is concave or hollowed out. By feeling the front of the pubic bone and the tip of the tailbone, you can determine the levelness of your pelvic tilt. Normally, these two landmarks should be level. Anterior pelvic tilting exists when the tailbone is higher than the pubic bone. That increases the arch of the lower back. And posterior pelvic tilting, when the pubic bone is higher than the tailbone, that decreases the curve of the lower back. Knee posture tendencies can be assessed by viewing yourself in the mirror facing straight ahead. Normally, the center of the thigh, between the knee and groin, and between inner and outer thigh, should be directly above the center of the knee and ankle while standing. Knock knee posture is when the knees are positioned inwards of that vertical line. Bow-legged posture, when the knees are positioned outwards from that line. Genu recurvatum from the side is when the back of the knee is not flat, but bulges backwards and pushes out in a convex pattern. Internal and external rotation of the knee is determined by looking at the position of the kneecap versus the foot. External knee rotation will exist when the foot is turned out at a different angle than the kneecap faces. Internal knee rotation exists when the kneecap is straight and the foot is angled inwards.